The first question, what do you think where the food is stuck in? Where is the problem when you swallow the food or the things? Where is the problem? If it is at the start of swallowing, if it is at the start of the swallowing, so it will be most likely neurological cause, and there will be like regurgitation of food or the liquids from the nose also. So it will be just like choking. Okay, it will be at the start, just he swallow and then immediately he's having the regurgitation. So it is neurological cause most likely, like the patient who is having bulbar palsy, pseudobulbar palsy. This is motor neuron disease patient, or the patients after stroke, patient with myasthenia gravis, patient with oculopharyngeal muscular dystrophies, and patient with sometime with Guillain-Barré syndrome also. So we have to ask the first question: where is the food the difficulty in swallowing, or where the food is stuck in? Okay, if it is at the start, this will be the differential diagnosis. If the patient says it is after swallowing, immediately at the level of my neck. So at the level of the neck, it means there is some mass in the neck. That could be thyroid involvement. So could be thyroid swelling. So next question should be, do you have any neck swelling? Yes, so it could be because of the thyroid swelling. Then other causes for swallowing difficulty at the level of the neck, it could be because of esophageal web or diverticuli, or could be because of C. esophagus at the upper 1/3 of esophagus. Okay, then the patient says, no, it is not immediately after swallowing, it is just like at the center of my chest, I feel the discomfort. So it could be of different causes. So we will ask the second question. The second question should be, what did you notice? Did difficulty in swallowing started with solid first, or the liquid first, or with the both? Okay, if the patient says it is started with the solid first, then there is a mechanical problem. There is a mechanical problem. So mechanical problem means it could be because of CA esophagus. It could be because of esophageal structure. It could be because of esophageal web again. It could be because of diverticuli. It could be because of mass in the mediastinum. It could be because of some big lymph node compressing the esophagus or the mass compressing the esophagus. So if it is starting with the solid and then worsening, so the mechanical causes will be top of our differential diagnosis. But if the patient says it is started with liquid and now it is progressing to solid, so again, if it is starting with the liquid, then the neurological causes will be at the top, like motor neuron disease cases, bulbar pseudobulbar palsy after the stroke, myasthenia gravis. Okay, but if the patient says my difficulty in swallowing started with both, if it is with both, you have to say so sad, so sad. This is the mnemonic SOSAD. So SO indicates Sjogren syndrome. Okay, you have to ask some questions related to Sjogren syndrome. After so, S is there. S is indicating systemic sclerosis. Then we have to ask the question related to systemic sclerosis. Any shiny skin, any thickening of the skin at the level of your fingers, okay, any ulceration in the finger, any blood channel visible on the face or any other part of the body. So the question related to systemic sclerosis. So said, the first so is Sjogren syndrome, then S is systemic sclerosis, and then A is indicating eclasia, okay, and then the T is indicating diffuse esophageal spasm, diffuse esophageal spasm. This diffuse esophageal spasm will be intermittent. In between, patient will be having no difficulty in swallowing. So this diffuse esophageal spasm is usually occurring with stress, anxiety, and with depression. So it is psychological also. So these are our questions that will give us the finding that where we have to go. The next question we have to ask, is it painful swallowing or no? If it is painful swallowing, then the mnemonic is I read. I is indicating infectious causes of difficulty in swallowing. Okay. Whenever it is painful swallowing, it will be esophagitis. So the mnemonic is I read. I is for infection, and the most common infections, either it will be because of candidiasis or it could be because of HIV. Okay. Then we have R. R is indicating reflux esophagitis. Reflux esophagitis, it will be related to drugs. Okay, I will highlight some drugs. Okay, then reflux esophagitis could be because of gastroesophageal reflux disease also. Okay, then the E. E is indicating erosive esophagitis. Erosive esophagitis is, for example, again, it will be because of medicines like bisphosphonate and other medicine. I will highlight now. Then another E is eosinophilic esophagitis. This eosinophilic esophagitis is associated with atopy, eczema, and hay fever. Okay, and the last one is D, again indicating the drugs-related causes. So this is our approach for any patient who is having difficulty in swallowing. What are the medicines that can cause the esophagitis or painful swallowing? So bisphosphonates, tetracycline, doxycycline, clindamycin, and NSAIDs, including brufen, aspirin, and potassium chloride tablets, and also nitrates sometimes can cause because nitrates relaxes the lower esophageal sphincter. So this should be our approach in cases with difficulty in swallowing. And this is very important. You will reach to the differential diagnosis. The reasonable differential diagnosis will be in front of you. In abdominal cases, we should ask the questions also with the mnemonic of alarm. A will be indicating anorexia. We have to ask the patient, do you have any loss of appetite or no? Then the L is indicating loss of weight. So we have to take the history of loss of weight also. How many kg over how much period of time, and it is intentional or unintentional. Then the A, next A is indicating anemia. Do you have any low blood cell count? Do you have somebody told you are looking pale? Yes, so you have to ask further questions of anemia also. Then R is indicating recent progression of the symptoms. For example, any patient who's having gastroesophageal reflux disease for a long period of time. Now there is recent progression of the symptoms with anorexia, loss of weight, and anemia. So it will become significant. So the patient will need urgent investigation. M is indicating melena or hematemesis also you have to ask. So, and the bleeding per rectum, fresh blood is coming or no? Any did you thrown up the blood or no? Okay, if both are no, then you have to ask any changes in the color of the stool, like do you have any time black tarry stool or no? Okay. S is indicating swallowing difficulty, and alarm positive. Positive means positive family history of any GI tumor. So these are the things that we have to ask. So any patient who is having positive alarm, significant 2 or 3 things positive in this patient, we should go for endoscopy in this patient. So lastly, I will give you the indication for endoscopy in patients with dyspepsia. So any patient who is having dysphagia, difficulty in swallowing, that is not improving with the treatment. And the patient with dysphagia that is also refractory to the treatment, we should go for endoscopy to find out the cause. Any patient with above symptoms having age factor also more than 55 years, so we should go for endoscopy. Any patient with alarm symptoms positive, better we should go for endoscopy. So this is about the approach of dysphagia.
For more detailed explanations and related topics, we invite you to watch our videos on our YouTube channel. Don't forget to like, comment, and subscribe to stay updated with our latest educational content. Thank you.